Hello and welcome to our latest video where we'll be discussing a concerning trend in the world of healthcare, the rising rate of colorectal cancer in younger individuals. In recent years, there has been a significant increase in the number of cases of colorectal cancer diagnosed in people under the age of 50. This is particularly alarming since colorectal cancer is often thought of as a disease that affects only older adults. The reasons behind this trend are not yet clear, and researchers are working hard to identify the risk factors and potential preventive measures. If you're interested in learning more about this topic, please don't forget to subscribe to our channel, hit the like button. And don't forget to hit the notification bell to be notified whenever we upload new content. We're committed to bringing you informative and educational videos about the latest health trends and topics, and we appreciate your support in helping us achieve this goal. So sit back, relax, and let's dive into the world of colorectal cancer and the rising rates in younger people. Be sure to listen to the end and check the description for the link to the questionnaire.
If you believe you are too young to have colorectal cancer, take into account the following. This year, around 20,000 Americans under the age of 50 will receive a diagnosis. And 3,750 young adults are anticipated to pass away. The authors of a recent study from the American Cancer Society state that colorectal cancer is rapidly moving to diagnosis at a younger age. Cases among those under 50 have grown by roughly 50% since the mid-1990s. It's one of this age group's worst malignancies. Many people at the time were not aware that the American Cancer Society has dropped the suggested starting age for screening from 50 to 45 years old in 2018. The FIT test, a screening procedure, can find minute amounts of blood in the stool. Generation Z and millennials are also at risk. Diet may be important. Statistically, those between the ages of 20 and 30 are significantly less likely than those 50 and older to have colorectal cancer, although cases in this age bracket are increasing. According to Dr. Kim Ng, director of the Dana-Farber Cancer Center's Young Onset Colorectal Cancer Center, they are predicted to rise by 90% by 2030. According to Ng, researchers are looking at a variety of things that might be contributing to the rise in colon cancer, including a lack of vitamin D, the complex function of the microbiome, the impact of consuming a lot of red meat, and the general influence of nutrition. In comparison to women who drank less than one drink, a study from 2021 indicated that women who consumed more than 2 sugary beverages daily had a more than doubled chance of developing early onset colon cancer. A recent study reveals that colon cancer risk is reduced in persons who consume a lot of fresh and minimally processed meals. In comparison to those who regularly consume items that have undergone extreme processing, such as prepared meals, sugary treats, carbonated beverages, and processed meats. A balanced diet may also help those who have been diagnosed with colorectal cancer avoid recurrences, according to a 2019 study. About 1,000 patients who had treatment for stage 3 colon cancer were monitored by researchers. They discovered that persons who often consumed items that might cause an insulin surge, such as white bread, beverages with added sugar, and processed snacks, compared to individuals who consumed the least of these meals, were about twice as likely to get colon cancer again or pass away from it. 1. Recognize the symptoms and signs. Early signs of colorectal cancer might include lethargy, bloating or a sense of being full, blood in your stool, a change in bowel habits, and weight loss for no apparent cause. You should talk to your doctor about being checked if you develop any of these symptoms. Every ethnic and racial group is experiencing an increase in young onset colorectal cancer, according to Ng. Therefore, everyone must be aware of the signs. 2. Don't let 45 get away from you. Colorectal cancer screenings should be conducted on all adults 45 and older. Don't disregard a stool sample test that your doctor mails you if you have a condition. If you have a family history of colorectal cancer or polyps and are younger, your doctor could advise early screening. 3. Discuss the history of cancer in your family. Ask your parents and siblings whether they have ever experienced polyps or received a colorectal cancer diagnosis. According to ING, colorectal cancer screening should begin for first-degree relatives, siblings, parents, or children, 10 years before the age at which the family member was diagnosed. Consequently, if your father had a colon cancer diagnosis at age 45, you should start getting checked at age 35. If you have a family history, discuss it with your doctor. 4. Select a screening method. You are not required to undergo the feared colonoscopy. There are other additional efficient screening techniques. Tr11, a gastroenterologist at Kaiser Permanente, claims that getting the test done has never been simpler. Screening procedures include colonoscopies, sigmoidoscopies, a less invasive scoping to examine a portion of the colon, and stool-based tests, which are frequently performed at home and sent to a laboratory for analysis. The fecal immunochemical test, FIT test, which may detect minute quantities of blood in the stool and is normally performed once a year, is one of the most frequently utilized stool tests. A stool DNA test, like Colorectal, is an additional choice. It can identify blood and DNA alterations that could be caused by a malignant or precancerous polyp in the stool. Those who select this option typically receive advice to have the test performed every 3 years. There are several options available, and patients should discuss with their doctors which one will be the simplest for them to complete, advises Levin. According to Dr. Douglas Corley of Kaiser Permanente, a colonoscopy is often advised if you have a family history of colon cancer or are otherwise at increased risk for the disease. He advises choosing the test you can successfully complete if you are not at high risk, whether that be a colonoscopy or one of the less invasive and more common stool-based tests. Are you unsure about where to go next? Take the Colorectal Cancer Alliance's Individualized Suggestion Test. See the link in the description. It will help you choose what is best for you if you enter your age and any symptoms you are now experiencing. 5. Alter your diet and up your exercise regimen. According to ING, one of the malignancies most closely associated with nutrition and lifestyle is colon cancer. A balanced diet may be protective, even if there are still many unsolved concerns regarding the factors contributing to the growth in colorectal cancer. Research indicates a Mediterranean diet may reduce the incidence of colon cancer. Additionally, there is mounting proof that a diet heavy in highly processed foods and sugary beverages might be detrimental.
In conclusion, the rising rate of colorectal cancer in younger people is a cause for concern and underscores the importance of regular screenings and preventive measures. While the reasons behind this trend are not yet fully understood, it is clear that early detection and timely intervention are crucial for improving outcomes and reducing mortality rates. We encourage you to talk to your healthcare provider about your risk of developing colorectal cancer and to take steps to reduce your risk, such as maintaining a healthy lifestyle, getting regular screenings, and seeking medical attention if you experience any symptoms. Thank you for watching our video, and don't forget to subscribe to our channel for more informative content on health and wellness.